From Penn State Health, thanks for tuning in to this Facebook Live video about magnet recognition. I'm Scott Gilbert. You might have heard the news recently that Penn State Health Milton Hershey Medical Center received its third consecutive magnet designation. That's deemed to be the highest national honor for nursing excellence. Less than 12% of registered hospitals in the U.S. have earned that. Now, here today to tell us a bit about why it is such an important designation are Stephanie Wachter and Dougherty. They're both staff nurses here at the medical center. Thanks for being here today, guys. Let's talk a bit about what magnet recognition does signify. Tell me a bit about that.
Well, magnet recognition is the highest honor for nursing staffs that achieve in the nation. What it signifies is that the nurses, physicians, and allied health professionals at the hospital work together to create excellent patient care outcomes through a series of processes that they've designed themselves.
And I think the institution has really put this at the forefront over the past few years when we look at our strategic imperatives and the vision for not just nursing as the profession, but the organization as a whole, to really put the patient at the center of that interaction.
And so I'm curious, since you're both staff nurses, you have obviously a lot of experience, working directly with our patients. What does it mean, first of all, for you as staff members to be able to say, as nurses, we work for a magnet recognized institution?
For me, it just kind of signifies that the level to which I practice and the level to which my colleagues practice is something that can achieve those high quality patient outcomes, and that we really do provide excellent care for our patients at this facility.
How about for you, Stephanie?
Well, for me, it's really more about my nursing practice being supported in many ways at the Med Center, whether it's the days that I engage in direct patient care, or if I'm involving myself in more professional development opportunities, such as going back to school or doing community outreach, or perhaps engaging in direct magnet activities like providing counsel work for our staff nurses as well.
And so people watching this, like I said up front, have probably heard the term magnet recognized, but they may wonder what it means for them as patients. Can you talk a bit about that? What's the significance? What can a patient expect at a magnet recognized hospital?
Well, patients simply need to know that a magnet organization is proven to have excellent patient care outcomes through collaboration among nurses, physicians, administrators, and leaders, and other allied health professionals that work at the hospital. So the patients that come to our hospital are getting the best care. The nurses that provide that care have a voice in how they provide it, and it's really proven to be the best thinking process around providing nursing care.
And that's how it translates for patients then, Jared?
Yeah, yeah. I think as a patient, being in that vulnerable position of being in the hospital and having to kind of have somebody else being responsible for your care, it gives them a little bit of ease of mind knowing that you're going to have a team really collaborating to keep you at the forefront.
You're watching a Facebook Live interview from Penn State Health Milton Hershey Medical Center. I'm Scott Gilbert. I'm joined by Stephanie Wachter, Dougherty. They're both staff nurses here. We're talking about magnet recognition and what that means. What does that tell us about our nurses here at the medical center? And I do know this is a very long and involved process to go for this designation. The medical center earned its first magnet designation in 2007, again in 2012, again in 2017. And in each time, there's quite a process to go through. Walk me through some of the basic parts of that process. It involves what? Writing, site visits, everything in between, right?
Yeah, so there's actually a team that gets together to write the magnet document. Thousands and thousands of pages of information goes into writing this magnet document, and a whole host of individuals throughout the organization kind of get together and collaborate to showcase the examples of excellent patient care that we provide here at the organization. So that then goes on to a team of magnet surveyors who will review that and then kind of get back to us and our magnet program director about a site visit date. And once the site visit date is here, it's really all about celebrating nursing and about celebrating the excellent patient outcomes that we have and the excellent environment that we work in.
Cool. What is it like to have that site visit when you get to kind of show off what you do?
Well, the site visit is really like the Super Bowl of nursing for me as a staff nurse. The surveyors say they're here to amplify and clarify the work that the nurses do. And I think that's a really great way to phrase it. It's important during the site visit that the information that was typed in black and white on the page really comes to life so that the American Nurses Credentialing Center representatives can really see that we live and breathe the magnet mission each day here at Hershey.
Right, make sure it's not just something you write down, it's something you actually live.
Absolutely.
There you go. The American Nurses Credentialing Center, that's the ANCC. They're the ones who designate hospitals, give out the magnet designation. They singled out Hershey Medical Center for a few particular initiatives and areas. Can you tell me about some of those?
Yeah, so one of the areas was, in particular, the way that nurses and physicians and other allied health professionals collaborate. So they actually, on the phone call that we received from them, recognized one of our units specifically for their initiatives in driving forth positive patient outcomes and really working together as a team to achieve those outcomes.
And also community outreach was recognized.
Exactly. The ANCC did recognize our strong community outreach department, and I've had the blessings to be able to work with the director of community outreach here at Hershey to kind of participate in some of those programs as well. They include providing patient education in the community at places like the farmers market here in Hershey or at food pantries throughout central Pennsylvania. It's an opportunity for me as a nurse to get to know patients before they become a patient so that I understand what their home life is like, so that the interventions we provide as nurses here are easily translated to things that we can do at home for them.
We welcome your questions for Jared and Stephanie. They're both staff nurses here at Penn State Health, Milton S. Hershey Medical Center. Feel free to put your questions in the comment field on this Facebook post, and we can certainly pose those questions to them about magnet recognition here at Hershey Medical Center. Major news that was just shared recently, and we're glad to have them helping us share it here as well. Now, 76% of the nurses here at the medical center have a Bachelor of Science in Nursing, or BSN degree, or higher. Why is that important? Because I know both of you have your BSNs. Tell me a bit about why that's important to you.
I think it really just validates the fact that the research shows that baccalaureate prepared nurses or higher really do achieve those great patient outcomes that we strive for here at Hershey, and they have the knowledge to kind of put that text that they read in their classes, in their undergraduate studies or their graduate studies, really into practice and make it come to life in the patient care setting.
All right. And for you, Stephanie?
I'll give an example. So one of the cornerstones of a bachelor's degree in nursing is understanding how to implement research into practice. And on the Cancer Institute where I work, we know that patients can sometimes get central line infections, and we've created multiple nurse-driven interventions to ensure that our patients don't receive central line associated infections when they come to us, just because we have the knowledge base and understanding of current practices and best evidence to implement for our patients here every day.
Fantastic. I think you've answered all my questions. Anything else that you guys would like to add about magnet designation and why it's important to a hospital like Hershey Medical Center?
I think the biggest take-home message about working at a magnet hospital is that the nurses' voices are heard, from the patient side through the interdisciplinary teams and the unit level, all the way up through senior leadership, and that the nurses who are the bread and butter workers at the hospital providing that direct patient care really are listened to and have direct decision-making capacity with regard to the care that they provide.
Any closing thoughts, Jared?
No, I mean, I'm just so fortunate to be able to have a facility like Hershey in my backyard and really be able to practice to the fullest of my extent that I can as a registered nurse here.
Cool. Well, we're going to share a story about the magnet designation. We'll share that in the comment field below this post. We'll also share a link to a recent video that we produced with a bunch of nurses here at the medical center sharing their thoughts on what this magnet designation means. Jared, Stephanie, thanks so much for joining me today. I appreciate it. And thank you for watching this Facebook Live interview from Penn State Health, Milton S. Hershey Medical Center.